Hello everyone, welcome to my Medication Academy channel. In this video, I will be sharing another FDA new drug approval update. In the first half of August 2025, the US FDA approved 3 novel chemical entity drugs. They are all small molecule oral agents. 2 are related to oncology, diffuse midline glioma, and non-small cell lung cancer. Both agents were approved under accelerated approval. The third one is for the treatment for bronchiectasis. Now, let's dive into each medication in more detail. Dordaviprone, brand name MODEYSO. This medication was approved by the US FDA on August 6, 2025, and indicated for the treatment for adults and pediatric patients aged 1 year and older with diffuse midline glioma harboring a H3 K27M mutation with progressive disease. Basically, for this indication, diffuse midline glioma is a very rare and aggressive brain tumor. With this particular mutation for H3 histone, you can see the mutation is at 27 position from the lysine to methionine. This medication is available as a capsule. The strength of the medication is 125 milligram. This is a small molecule with the hexahydroimidazole-pyridine motif along with the benzoyl motif on both sides. So in the middle, there's a tricyclic core motif in the middle. Given this is a small molecule, the molecule weight is 386.5 gram per mole. Hydrogen bond acceptor 5. Hydrogen bond acceptor refer to the number of oxygen and nitrogens within the drug molecule. Hydrogen bond donor 0. Hydrogen bond donor refer to the number of hydroxy and NH groups within the drug molecule. Log P 3.14. Log P, that's the lipophilicity profile parameter of the drug molecule. The higher log P, which means more lipophilic. In this case, it's over 3, so therefore this is a lipophilic drug molecule. Also think about this is for brain tumor, so therefore this medication is able to penetrate the blood-brain barrier, BBB. Polar surface area, 39 square angstrom. Recommended dosage for adults, 625 milligram, that's 5 capsules, taken orally once weekly on an empty stomach, at least 1 hour before or 3 hours after food intake. For pediatric dosing, it's a weight-based dosing, 125 to 625 milligram, taken orally once weekly. See prescribing information for details. Mechanistically, this medication works as a protease activator of the mitochondrial caseinolatic protease P, that's the CLPP, along with blocking the dopamine D2 receptor. So basically this medication, particular indication is a diffuse midline glioma, so that's the brain tumor with this particular mutation at the 27 position, the lysine to methionine. So therefore, by this mutation, so this would will be losing the trimethylation from the lysine. So therefore, this medication works as a protease activator of the mitochondrial caseinolatic protease P, CLPP, along with blocking the dopamine D2 receptor. Pharmacokinetically, Tmax, that's the time to reach the maximal plasma concentration, 1.4 hour. Volume of distribution, 450 liter. Protein binding, 95 to 97%. Metabolism. This medication is primarily metabolized by CYP3A enzyme, along with some other CYP enzymes 2B6, 2C8, 2C9, 2D6, and 3A5. Half-life is about 11 hours. Excretion in the urine 70% and in the feces 20%, but mostly as metabolites in the urine and feces. Drug-drug interactions. Giving this medication is metabolized by CYP3A4 enzyme. So therefore you can see for strong and moderate CYP3A inhibitors, avoid concomitant use. So the reason for that, this would increase the drug exposure for dordaviprone. If unavoidable, so make sure lower the dose accordingly. For strong and moderate CYP3 inducers, this would lower the drug exposure, so therefore avoid concomitant use. For patients, if they also take some other drugs known to prolong the QTC interval, and avoid concomitant use. If unavoidable, so make sure space out the medication accordingly. Adverse effects greater than or equal to 20%, fatigue, headache, vomiting, nausea, musculoskeletal pain. Zongertinib, brand name HERNEXEOS. This medication was approved by the US FDA on August 8, 2025, and indicated for the treatment of adults with unresectable or metastatic non-squamous non-small cell lung cancer, whose tumors have HER2, so that's the gene you can see a mutation for ERB-B2, tyrosine kinase domain, activating mutations. So basically this is more specific for HER2 targeting medication. You can see under the brand name, so that's HERNEXEOS. That also kind of indicates this medication works specifically for this HER2. This medication is available as a tablet, 60 milligram. It's a small molecule with the piperidine and pyrimidine, the bicyclic ring motif in the middle, along with the benzimidazole motif on the right side here. Recommended dosage, weight-based dosing for patients. The weight is less than 90 kilogram. The dosing is 120 milligram, taken orally once daily with or without food. For patients, weights if greater than or equal to 90 kilogram, the dosing is 180 milligram, so which is 3 tablets, taken orally once daily dosing. As mentioned, given this small molecule, you can see the molecule weight is 535.6 gram per mole, hydrogen bond acceptor 11, hydrogen bond donor 2, log P 2.6, polar surface area 123 square angstrom. Mechanistically, this medication works as a kinase inhibitor, also giving the suffix, you can see the drug name ending with tinib. So that's the kinase inhibitor of HER2. So that's the human epidermal growth factor receptor 2. By blocking this specific HER2 kinase, this would blocking the downstream phosphorylation of ERK pathway. That's the extracellular signal related kinase. So therefore, this would causing the programmed cell death will have this anti-cancer effect. Pharmacokinetically, Tmax, that's the time to reach the maximal plasma concentration, it's about 2 hours. Half-life is about 12 hours. Oral bioavailability, 76%. Volume of distribution is 118 liter. Protein binding, it's over 99%. Metabolism, this medication is metabolized by CYP3A4, CYP3A5, along with the phase 2 conjugation metabolism with UET1A4, so that's conjugates with the glucuronic acid and also conjugates with the glutathione. And go through the phase 2 conjugation metabolism. Excretion in the urine 1.3%, but 0.2% as a parent drug molecule. In the feces, 93%, but 31% as a parent drug molecule. Drug-drug interactions. Given this medication is metabolized by CYP3A4, so therefore you can see for strong CYP3 inducers, avoid concomitant use because the CYP3A inducers, this would decrease the drug exposure for zongertinib. So therefore this can have a decrease the efficacy. If unavoidable, so this can increase the dosing accordingly. BCRP substrates. The BCRP, that's the breast cancer resistant protein. In particular for BCRP substrates with a narrow therapeutic index. So make sure avoid concomitant use or monitor the patients closely for adverse effects. So the reason for that, this medication, zongertinib, is a BCRP inhibitor. So therefore, this can increase the drug exposure for BCRP substrates for patients if they take other medication, if they are BCRP substrates. So this can lead to increase the drug exposure, can have a potential adverse effect as well. Adverse effects greater than or equal to 20%, diarrhea, hepatotoxicity, that's the liver toxicity, rash, fatigue, and nausea. Brensocatib, brand name, BRINSUPRI. This medication was approved by the US FDA on August 12, 2025, and indicated for the treatment for adults and pediatric patients aged 12 years and older with non-cystic fibrosis bronchiectasis, NCFB. This is a small molecule with 1,4-oxazepine, so that's the 7-membered ring, so that's 1,4-oxazepine, cyano group, as well as the 2-oxadihydrobenzoxazole, so that's the heterocyclic motif on the right side. This medication is available as tablets. The strength is 10 mg or 25 mg. Recommended dosage 10 mg or 25 mg, taken orally once daily with or without food. As mentioned, this is a small molecule. Molecule weight is 420.5 gram per mole. Hydrogen bond acceptor 8, hydrogen bond donor 2, log P 0.92, polar surface area 104 square angstrom. Mechanistically, this medication works as a competitive and reversible DPP1, that's the dipeptidase 1 inhibitor. So by blocking DPP1 enzyme, this would blocking the pro-inflammatory neutrophil serine protease NSP during the neutrophil maturation in the bone marrow. So therefore, this medication kind of targets the inflammatory factor. So in this process, so that's the bronchiectasis, that's the chronic lung disease, inflammation. Pharmacokinetically, Tmax 1 to 1.4 hours, absorption over 80%, volume of distribution at steady state 126 to 138 liter, protein binding 87.2%, metabolism. This medication is primarily metabolized by CYP3A enzyme, and then the CYP2C8 and the 2D6 play a minor role in the metabolism. Half-life is 25 to 39 hours, so therefore it's a pretty long half-life. It's once daily dosing. Excretion in the urine 54.2%, but 22.8% as a parent drug molecule. In the feces 28.3%, but 2.4% as a parent drug molecule. Drug-drug interactions. Strong and moderate CYP3A4 inhibitors, inducers, or the P-glycoprotein inhibitors. This would impact the BRINSUPRI exposure. So for example, this medication is metabolized by CYP3A. So therefore, for patients, if they take strong and moderate CYP3A inhibitors, so for example, the antifungal agents, the itraconazole, or the macrolide antibiotics and clarithromycin. So this would increase the drug exposure for BRINSUPRI. Similarly, for patients, if they take a strong and moderate CYP3A inducers, so for example, the anti-seizure medication, the phenytoin, or rifampin, or shundoxorid. So this would decrease the drug exposure for BRINSUPRI. So in other cases, this would impact the drug exposure, and so therefore needed to make some dosing adjustment accordingly, or need to monitor the patients accordingly. For the adverse effects. Adverse effects greater than or equal to 2%, upper respiratory tract infection, headache, rash, dry skin, hyperkeratosis, palpitation. These are the key references which I have used to prepare for today's video. The US FDA New Drug Approval 2025 is a very valuable resource. In addition, most of the medication information which I shared today for all these three products are based on their respective prescribing information documents. And all these documents are available on the US FDA drug website, along with the manufacturing website as well. Finally, I want to thank you all so much for watching. If you find the video useful and informative, please consider subscribing for future medication video updates. As always, keep learning and elevating. Thank you so much.